If you are a senior on Social Security or food stamps, or you know somebody that is on food stamps, listen up. I have some news about changes that are coming. The Trump administration and Republicans in Congress have a plan to change food stamp benefits in a dramatic way. And Elon Musk is trying to eliminate $2 trillion from the budget, and that is including food stamp benefits are going to be affected. There's no way around that. I'm going to bring you all the details. And then there are 10 surprising Medicare services that are not covered. And I'm going to show you how you can pay for those services which are not covered by Medicare. And then if you stay till the end of this video, the IRS is about to send stimulus checks to those who missed their stimulus check previously, and it's going to start going out this month. And so I'm going to bring you all the details. If you're new here, hit the like button, hit the subscribe button, because all we do is bring you the latest news and update in and out of Congress that may affect your food stamps, Social Security, Medicare, and any personal financial news that affects seniors. So before we get to the main items of the day, let's talk about Medicare Advantage enrollment for a second. This news bulletin came out where 1 million plus patients have lost coverage because their insurance and hospitals have dropped their Medicare Advantage plans. And this is something that seems to be happening a lot. And so I wanted to talk about Medicare Advantage plan enrollment a little bit, because a lot of you need to pay attention to what is happening and why this is an opportunity to switch. So Medicare Advantage open enrollment runs from January 1st through March 31st. So it is a 3-month process, allowing beneficiaries to switch or return to original Medicare. Now, here is the big deal. There are 24,000 Medicare plans nationwide, and it can be very confusing, which is why studies have shown that 90% of seniors are in the wrong Medicare plan. So what does that do? It's costing you money, because on average, couples spend over $300,000 on Medicare during retirement, and it's affecting your health, because imagine needing services and realizing that your coverage has been dropped or your provider doesn't provide that service. And so recent changes have led many Medicare Advantage plans to disappear from certain states, making coverage challenging. But here's the good news. During this enrollment period, you can switch to a new Medicare Advantage plan and have great news. I have been doing content for seniors since 2011. We have never recommended a partner for Medicare or anything because it's never felt right. We've been right. We have websites that we've been managing. We have 100,000 followers on TikTok, and we've never recommended a partner until now, because this partner, Chapter Medicare, is the real deal. And I'm going to give you 3 reasons why you should be calling Chapter Medicare today and trying to get them to help you get Medicare Advantage plan that fits your needs. And I'm going to put their number on the screen, as you can see. And here are the 3 reasons why you should be talking to Chapter. Number 1 is that they have access to all 24,000 Medicare Advantage plans. They are the only company that does. They are the only free, unbiased advisor with access to all the Medicare plans. So they can look at your Medicare Advantage plan and find something that fits your situation and your budget. Number 2, which is the most critical reason why I decided to partner with them, their Medicare advisors are not working on commission. So they are not going to recommend a plan to you because it's going to give them the highest commission. They are going to look at your situation and recommend a plan that fits your needs. And then the third part, most importantly, Chapter Medicare can save you $1,100 a year on average if you work with them to find you the right Medicare Advantage plan. Again, Medicare Advantage plan enrollment is now. You cannot wait. This is urgent because the window is closing. So call the number for Chapter Medicare. It is free and it's easy to do so. Look in the description or call the number you see on the screen, and they'll be able to help you find the best Medicare Advantage plan that fits your needs. So act now. Now let's talk about the main topic of today. So I'm going to talk about 5 changes to food stamps that are coming that is from three different sources. The first one is that the Trump administration is working right now to make changes to food stamps. Elon Musk is also working to cut spending. And then the GOP in Congress are also in discussion with the administration to make changes. So, what does that look like? Here are the 5 big changes that are coming. The first one is the harvest box. When Trump was in office previously, he floated this idea where he's going to replace a good chunk of food stamps with a government box. Basically, here's how it's going to work. Each month, the federal government is going to send you a box of food, which is going to be things that they think you should be eating. And it's going to be the same for everybody. And it's take it or leave it. And so instead of you taking your SNAP benefits or your food stamp card and going to the grocery store and buying the food that you like, President Trump wants to replace it with a Harvard box. It was something he proposed previously. He got a lot of pushback on, and now it is back in discussion again. And together with Republicans in Congress, they are proposing big cuts to Medicaid and food stamps. Now, here is an article that I read recently that's talking about the harvest box. Trump's past budgets have envisioned much more sweeping cuts. His latest one proposed a nearly 30% cut to the program, which is food stamps, including new work requirements on top of those already in the program, and a plan to shift a big share of the program into a harvest box, a plan in which households would not get to choose the food they buy, but instead be sent a monthly box of shelf-stable foods that the government picks. Realistically, the writer writes, I suspect the harvest box plan in particular will struggle to gain traction, in part because major retailers like Walmart and Kroger previously pushed back on this proposal. But are they going to be able to push back now, especially this year when Republicans have control of the House, the Senate, and the presidency? This harvest box idea now is looking really, really, really possible. On top of that, Glenn Thompson, the Republican chair of the House Agricultural Committee, released his proposed farm bill in May. Its most striking provision will limit the ability of the Department of Agriculture to update the Thrifty Plan. Now, remember, the Thrifty Plan is how you get big jumps or big increases in your food stamps benefit. When you remember during COVID, food stamp beneficiaries got a big 30% increase, which updated the program to catch up with inflation. Well, this proposal is going to limit that ability of the government to increase food stamp to catch inflation. And so it's going to put the food stamp program back again behind inflation, where your money is able to buy less and less and less. And this is supposed to save the government $30 billion over a decade. So the program, food stamps, is a huge safety net for a lot of people. 20% of the people who are on food stamps have no other income. And the current plan is to cut $30 billion over a decade. And as I mentioned, the president's plan to bring the harvest box back is going to be devastating because it's going to replace a big chunk of the food stamps program with a government box that you receive every month. And I am not making this up. Google it. It was something that Trump proposed when he was in office previously. And Democrats were in control of the House. And so they couldn't pass that. But now that the Republicans have control of all the government, it's going to be hard to not to see how this proposal does not get through. And this is what it's going to look like. Each month, you're going to get a box of things the government thinks you should be eating. And now that they've been talking about other things I'm going to talk about soon, it's all going to make sense to you why this idea is not far-fetched. The second proposal is Elon Musk and what he wants to do with spending. And here again, guys, I know when I talk about things like this, I am only reporting facts. A lot of you come at me and say I am lying, it is fraud, it is fake news. Everything I'm going to talk about today, I'm backing it up. So let's talk about Elon Musk and his plan to cut $2 trillion from the budget. And here's what I'm going to tell you. There is no way he's going to be able to cut $2 trillion from the federal budget without cutting Social Security, Medicare, and food stamps. Let me prove it to you. You do the math. So here is the government budget. The government brings in $4.43 trillion a year and spends $6.13 trillion. So there is a deficit of $1.695 trillion. Why is that important? Well, Elon Musk wants to cut 2 trillion. So he basically wants to balance the budget. But the problem is that you cannot balance the budget or cut 2 trillion from the federal budget without cutting Social Security, Medicare, food stamps, and other programs. Let me prove it to you. This is where the money comes from. 50% of the money the government gets come from individual income taxes. 37% from payroll taxes. Corporations, big corporations, all the corporations that we see in the world, and they provide only 9% of the revenue to the government. Most of it is individual income taxes, payroll taxes, and then there's a tiny percent that comes from other sources, including tariffs. The president has been talking about tariffs a lot. Less than 4% of the budget or income that comes in comes from tariffs. So 50% from individuals, 37% from payroll, 9% from corporations, and then everything else from everybody else, tariffs, custom duties, etc. So here is how the government spends its money. You can see Social Security is the biggest item on the budget, followed by health, which includes Medicaid. Number 3 is Medicare, then national defense, then income security, which includes food stamps, which includes SSI and other programs. And then you have interest on the national debt, veterans benefits, transportation, commerce and housing, etc., etc. This is the 15 list of things that the government spends its money on in that order. And you can see number 5 is income security. That includes SNAP, housing assistance, unemployment benefits. And then if you look at health, Medicare, including children's Medicare, etc. Now, let's look at the details, how these things break down in terms of dollars. Social Security is the biggest item on the list, $1.354 trillion, followed by health, which includes Medicaid, children's health insurance, and other items, $889 billion. And then Medicare, $848 billion. National defense, $820 billion. Income security, which includes unemployment compensation, SNAP benefits, which is food stamps, supplemental security income, TANF, housing assistance, refundable tax credit, $775 billion. And then interest on the national debt, $658 billion. And then veterans benefit, $302 billion. This is the bulk of the budget. Then everything else is under these 3 categories: transportation, commerce and housing credit, community and regional development. So if you take Social Security, you add what we're spending on Social Security, you add health, you add Medicare, you add income security, you add veterans benefits, it equals 4.16 trillion. Now let's go back and let me show you how much the government brings in revenue. The government brings in 4.439 trillion. So the government brings in enough revenue to just cover those things. Now let's look at what other things the government doesn't want to touch. Net interest. The government is not going to renege on interest payment on its debt. So that's 658 billion. They're not going to touch it. It's going to ruin everything. And Congress likes to borrow money, so they're not going to touch interest and send like the markets all the way in a tailspin. And they're not going to touch defense, which is 820 billion. So if you add defense and you add net interest, it's 1.47 trillion. All right, so guys, where are we going to get the 2 trillion that Elon Musk wants to get from the government? Where are we going to get it from? If you're not going to touch defense, if you're not going to touch interest, what is left? Because the money is not in transportation, commerce and housing credit, community and regional development. The money is here in national defense, income security, net interest, veterans benefits, Social Security, health, and Medicare. So President Trump says he's not going to touch Social Security. He's not going to touch Medicare. All right, so if we're not going to touch Social Security, we're not going to touch Medicare, we're not going to touch defense, we're not going to touch interest, where is the money going to come from? So you begin to see that either what they want to cut is not possible, or they're going to touch what they say they're not going to touch, or they're going to lean heavily on vulnerable populations and try to take the money from there. Because there is no way that there's not enough money to go around if you're not going to touch Social Security, you're not going to touch Medicare. Well, then you're going to chop up Medicaid, which a lot of seniors are like, oh, yeah, they can take Medicaid. It's not going to affect my Social Security and it's not going to affect my Medicare. But here's what you don't know about Medicaid. A lot of seniors that go into nursing homes or long-term care have their bills paid by Medicaid. Actually, majority of long-term care expenses paid by the government by people is paid by Medicaid. A lot of seniors don't know that your Medicare does not cover long-term care. It's Medicaid for people who don't have money. So if you get to the point where you have to go to a long-term care facility, you don't have the money, Medicaid is what's going to cover you. So if they got Medicaid, then that's not going to be available to you. So my point is that the numbers don't lie. The math is the math. So either they're not going to cut $2 trillion, or they're going to cut things that they told you they're not going to touch, or they're going to focus on the vulnerable population. And I think income security is going to be a target. So food stamps, SSI, TANF, housing assistance, refundable tax credit is going to be a target. Veterans benefits and services is going to be a target because they touch programs that do not have huge lobbyists in Congress that are lobbying them. And when you talk about income security, nobody's on the Capitol Hill lobbying for food stamp recipients. Not a lot of people are on Capitol Hill trying to, lobby for veterans benefits. Even though there are significant groups, they are not as powerful as the defense lobbyists and other lobbyists. So then they go touch health, Medicaid. So my point is that, look, we're all looking at the same numbers. I want you to tell me, I'm just presenting the numbers to you. This is the budget. This is how the government spends its money. Elon Musk wants to cut $2 trillion. Now he has access to the entire federal payment system, so he can see everything. This is what he's going to see. This is where the money is spent. So where is the $2 trillion going to come from? So I want to hear from you in the comment section. Tell me how you would take $2 trillion out. Or if you don't think they can get $2 trillion, where do you think the money is going to come from? Because I'm telling you that food stamps are going to be impacted. Medicaid is going to be cut. And I'll be surprised if they go for $2 trillion and don't touch Social Security and Medicare. And I did a whole post about 5 ways that Social Security can be reformed. And they may not cut benefits, but they will increase the retirement age. They can increase the retirement age so that they can make it harder for people to get Social Security. And that's a way to slow down how much money is coming out of the system. So there's many things they can do in fixing Social Security that may not affect your check right now, but it may create problems down the road, because 2034, if nothing is done, there will be automatic 21% cut in Social Security benefits. So that is what I wanted to share with you, that these are the 4 programs, 5, that total 4.168 trillion. And if they're not going to touch these 2, then I don't know where the money is going to come from. So in my opinion, Medicaid is on the chopping block, SNAP, SSI, SSDI, veterans benefits. And the question mark is, will they touch Social Security and Medicaid? That is if they insist on getting $2 trillion. If they insist on getting $2 trillion, then there is no way possible they cannot touch those 2 programs. So let me know in the comments. You may have some information I don't have, but this is all publicly available information that everybody can access about how the government brings in money, what the government spends money on, and how it's impossible to cut $2 trillion without touching programs that people care about. Now, Doge is in full steam. Elon Musk is proceeding. He has access to everything. Recently, they said they have 29-year-olds, 24-year-olds, and 19-year-old programmers that have access to the government's payment system and are making changes fast. That is information that has been reported. And this is what Senator Elizabeth Warren has been alarmed by, because I don't know how this is going on, but this is what we're experiencing. So let me know what you think about what I talked about regarding Social Security, food stamps cuts. I just want to hear from you. You tell me what you know, because I don't think it's possible without doing some damage. Now, let's talk about change number 3. There's idea that has been floated around to cut junk food from food stamps. And this is going to be a $25 billion issue, because that is how much is spent on junk food on food stamps. And there's been a movement to try to cut junk foods out of food stamps. Now, Arkansas Governor Sarah Huckabee Sanders has written a letter to the U.S. Department of Agriculture and Nutrition Service requesting new limitations on SNAP. The request aims to restrict junk purchases with federal food assistance benefit. SNAPs are administered nationwide to low or no income households that will otherwise struggle to purchase groceries. Now, here's the thing. Whether you agree with her or not, there's one fact you need to know. People on food stamps do not purchase junk food in any higher ratio than the rest of the population. There has been studies that have been done that have proven that people on food stamps don't buy food any different than the regular population when it comes to junk food. So it may be that they're targeting food stamps recipients because the government is giving you money, so the government gets to decide what you can eat. It may be that, but it's important for you to know that data. So now let's talk about work requirements. This is something you're going to hear about a lot. There's going to be stricter work requirements coming to food stamps, and that is a fact. The administration is getting ready to do that, and there's news all over it in the Senate, in the House, about stricter work requirements for people on food stamps. Recently, they changed the work requirement so that if you don't have dependents, you have to be up to 59 years old and continue to work. So if you're getting food stamps up to 59 years old, you have to work. Very soon, I won't be surprised if they push that to 63, 65 to get food stamps, which means that if you're getting Social Security, you're retired and you're getting food stamps because you don't have money to buy food or enough money to buy food, you may have to continue to work just to get the food stamps benefit. And that age used to be 54. They just pushed it to 59. And very soon, I won't be surprised if they push it up further. And that is going to cause a lot of pain to a lot of people, but that is what we're dealing with right now. And the last change is that in some states, there's been waivers that allow people to not have to meet work requirements because of high unemployment in their areas and other issues. And now those waivers are going to be gone, because I don't think the current administration is going to allow those waivers to continue. So if you are receiving food stamps and you are in a particular area and you haven't been meeting food stamps requirements, or you've been exempted from some requirements, know that Congress is going to make changes soon that's going to put you back to meeting those requirements. So let me know what you think. I've given you 5 potential cuts to food stamps, 5 potential changes to food stamps. I want to hear from you in the comments what you think is going to happen. I shared the budget with you. If you agree with it or disagree with it, I want to hear your feedback. Where do you think they're going to get the money from? Happy to chat with you on that. Switching topics now to something more exciting, Medicare. Medicare has a lot of things, major services that are not covered, and it leaves seniors with big bills that they cannot cover. And so I've done extensive research, because one of the comments that I see a lot is people finding out that a particular Medicare services that they wanted is not covered, and now they don't know how they can pay for it. So I'm going to walk you through 10 surprising things that Medicare doesn't cover, and then give you tips on how to get them covered. Now, a lot of these have Medicare Advantage plans as solutions. So I've shared with you earlier, my partner, Chapter Medicare, is here to help you. So the number you see on the screen, call them. It's free. They have access to 24,000 Medicare plans. They are the only ones that have access to everything that is in the database, and they can pick a plan that meets your needs. They are not paid commission, so they are not trying to sell you the highest commission plan. They are there to help you, and they can save you up to $1,100, and the consultation is free. Just call them or fill out the form in the description, and you'll be on your way to saving $1,100 a month. Now, the first thing is dental care. Original Medicare does not cover dental for routine dental care, including preventative cleanings, fillings and extraction, dentures, or major procedures like root canals and implants. While Medicare may cover certain dental services that are integral part of covered medical procedure, it won't cover any routine dental care. And here's how much it costs. Basic cleaning, single crown, root canal, full set of dentures, single implants, all cost a lot of money. So how can you get them covered? Well, the first thing is you can get a Medicare Advantage plan with dental benefits. You can get a standalone dental insurance, which costs about $20 to $50. You can get dental discount plans, which cost about $100 to $200. And you can go to a dental school for discounted care. Dental, vision, hearing combo plans, and community health centers can help you get low dental insurance. The next thing is vision care. Medicare Part B covers some vision care related to medical conditions like cataracts, glaucoma, or diabetes-related retinopathy. It doesn't cover routine eye care. This means that basic vision services like eye exams for prescription glass, the cost of frames and lenses, or contact lenses are not covered under original Medicare. So what do these services cost? Well, routine eye exam, $125 to $200. Basic prescription glasses, $200 to $600. Contact lens fitting, $100 to $200. Annual contact lens supply, $200 to $600. And LASIK surgery, $2,000 to $3,000 per eye. How can you get them covered? You get a Medicare Advantage plan with vision coverage, or you get vision insurance, or you get vision discount programs. If you have an HSA or FSA fund, you can use that for qualifying expenses. And then optical chain stores have membership programs that can help with this cost. Next, we go to hearing aids. Medicare does not cover hearing aids or routine hearing exam, while it may cover diagnosis hearing tests if ordered by a physician to assist in treating a medical condition. It won't cover the cost of hearing aids or fitting. This gap in coverage is particularly significant given the high cost of quality hearing aids and the importance of hearing to quality of life. So what do these services cost? Well, basic hearing aids is $1,000 to $2,000 per year. Premium hearing aids, $3,000 to $7,000 per year. Wow. Hearing exam, $75 to $250, and then annual maintenance, $100 to $400. So how can you get these things covered? Well, you can get a Medicare Advantage plan with hearing benefits. You can get over-the-counter hearing aids. Now, new legislation came in August 2022 that allow you to get hearing aids in certain categories over the counter without a fitting by an audiologist. You can get hearing aid discounts. If you're a veteran, you can get veteran benefits if possible, or your state Medicaid program can help you, or nonprofit organizations also offer help. Number 4, long-term care. I told you that earlier. Medicare does not cover custodial care or long-term care services, which includes assistance with living daily activities like bathing, dressing, eating. While it may cover short-term stay in skilled nursing facilities following a qualified hospital stay, it won't cover extended nursing home or assisted living facilities. And these things cost a lot of money. As I mentioned earlier, Medicaid ends up paying for a lot of these. Nursing home, $90,000 to $100,000. Assisted living, $45,000 to $65,000 a year. Home health aid, $20 to $30 an hour. Adult daycare, $75 to $100 a day. So how can you get these covered? Long-term care insurance, life insurance with a long-term care rider, Medicaid for eligible individuals, veterans benefits, reverse mortgages, and health savings accounts. Number 5, routine physical exams. While Medicare covers an individual's welcome to Medicare preventative visit and annual wellness visit, it doesn't cover comprehensive physical exams. The annual wellness visit is limited in scope than a full physical and does not extend lab work or detailed physical examination. So you're getting very limited services with your Medicare covered annual wellness exam. So if you want something more comprehensive, you have to pay $200 to $400. Basic blood work is $100 to $300. Additional screening is $100 to $500. So how can you get this covered? Well, you can get a Medicare wellness visit, which is the one that is covered, and just take it as is, or you can get a Medicare Advantage plan, secondary insurance coverage, HSA or FSA accounts to help you cover it, or preventative care packages from your health insurance. So most health providers now will give you a free annual exam. So check with your health provider if they do that. Number 6, food care. Medicare generally doesn't cover routine food care such as nail trimming, corn and callus removal, or hygienic care. While it covers podiatry services for specific medical conditions like diabetes, routine food maintenance is not included. And this is how much it costs. It's not cheap. So how can you get these services covered? Well, Medicare Advantage plans, some of them do cover it. Supplemental insurance, podiatry discount plans, HSA and FSAs, and medically necessary documentation when possible. Number 7, alternative medicine. Most alternative medicine, complementary medicine treatments are not covered by Medicare. While it may cover some forms of medically necessary chiropractic care and acupuncture for chronic lower back pain, most alternative treatments, including massage therapy, naturopathy, and homeopathy, are not covered. And they cost a lot of money. A session for massage is about $60 to $120 per session. Acupuncture, about $150 at the upwards parts of it. Chiropractic care, $20 to $200, $60 to $200 per visit. And sometimes you may require a lot of visits to just get through the pain. And then natural supplement varies. To get these covered, some Medicare Advantage plans will cover your acupuncture and chiropractic care. Alternative wellness discount programs, wellness program memberships, HSA and FSA for qualifying treatments, and package deals from some providers. Number 8, overseas medical care. A lot of seniors travel, they go on trips, and then there's a medical issue, and now it's like, who is going to cover it? Original Medicare doesn't cover health insurance services received outside the United States, except in very limited situations. This could leave travelers exposed to significant medical expenses when abroad. What are the costs? Emergency care varies widely. Evacuation insurance is $100 to $500 per trip. Travel insurance is 4 to 10% of your trip. You can cover it with Medigap plans with foreign coverage, travel insurance with medical coverage, medical evacuation insurance, international health insurance, and credit card travel benefits. Number 9, medical equipment not deemed necessary. While Medicare covers durable medical equipment that is prescribed by a doctor as medically necessary, it won't cover equipment considered primarily for convenience or comfort. This includes many items that can enhance quality of life but aren't strictly medical in nature. So what are we talking about? Lift chairs cost $600 to $2,000. Walk-in tubs, $2,000 to $10,000. Home modification, $3,000 to $15,000. Adult diapers, $100 to $200 a month. How are you going to cover this? Well, your Medicare Advantage plans could do that. State assistance programs, veterans benefits, home modification grants, Medicaid waivers, and nonprofit organizations can assist you in these categories. And then finally, cosmetic surgery. I'm surprised by how many people ask if Medicare covers cosmetic surgery. It doesn't. Medicare only covers plastic or reconstructive surgery that is medically necessary, such as after an accident or mastectomy. It doesn't cover any cosmetic procedures done purely for aesthetic purposes, regardless of their impact on self-esteem or quality of life. So here are the costs of each of those items, and you can see it's a lot of money. How do you get them covered? Well, medically necessary documentation where applicable, healthcare credit cards, provider payment plans, HSA and FSA for medically necessary procedures, medical loans and savings accounts, and dedicated to specific procedures. So here's the thing. Chapter Medicare can help you find a Medicare Advantage plan that suits your needs. because most of these things that I've talked about involve Medicare Advantage plans. This is the window to switch. It's very short. So call them today or fill out the form in my description. There's no risk to you. It's free. And I tell you, they've saved people $1,100 a year. And that's a lot of money. So give them a call. Now let's talk about stimulus. So the IRS is about to send stimulus checks to people who missed their stimulus during the pandemic. Now, when I've done a post about this before, people get bent out of shape because they're not listening to what I'm saying, or they didn't hear the entire presentation and they hear snippets of it and then they lash out. This is specific to people who did not get their stimulus checks. So let me walk you through it. But in the meantime, if you like everything you've been hearing, click the like button, click the comment button. Let me know your thoughts and subscribe if you like what you're hearing. So the IRS is about to send out tax stimulus checks to 1 million taxpayers, and this has been all over the news. And so I'm just going to walk you through. This is NBC News talking about it. This is ABC News talking about it. This is CNBC talking about it. And this is a local news organization that did something about it. So it's all over the news. So what is this about? Well, when you go to the IRS website, it will tell you who is eligible. But I've done the research and I'm going to tell you. So they've announced a 2.4 billion stimulus payment program targeting 1 million Americans who missed their previous pandemic payment. And this is not a new stimulus. The money will be automatically deposited into the bank account starting in January 2025. Recipients don't have to do anything. They don't have to fill any form. This initiative is specifically designed to catch those who missed their pandemic stimulus payment, particularly focused on the $600 payments and $1,400 rounds from 2020 to 2021. So if you did not get a stimulus check, this is an opportunity to look into this because this is the final catch up they're doing, and then that issue will be put to bed. Payment distribution will be automatic based on the IRS database, and they will identify those who missed the payment and send the money to you. But you can go to their website, as I showed you, and claim your 2021 recovery credit rebate, or you claim your 2020 recovery rebate credit. It's right there on their website. So if you didn't receive a stimulus check, especially the $600 one and the $1,400 rounds, this is your opportunity to get that money. So who gets the payment? The IRS is conducting a comprehensive review of their internal data to find people who were eligible but never received their full stimulus payment during the pandemic. Target recipients are those who didn't file tax returns. Here's an important part. Target recipients are those who didn't file tax returns but were eligible for recovery rebate credit in 2021. Many may not even know that they qualified. Each eligible person can receive up to $1,400, which was the amount of the third stimulus payment authorized under the American Recovery Plan. Recipients will either get a direct deposit if the IRS has their information, or they'll get a paper check in the mail. So don't throw anything that looks like a government check. Don't throw it away. It may be your stimulus check. Now, for those people who are going to get the $1,400, you just wait. The IRS will send you the money. Monitor your bank account and make sure that you're checking to make sure that the money didn't hit and you just didn't realize it. And then there are other changes that are coming, which I can talk about later. So the point is, the IRS is sending stimulus to people who didn't receive it. If you feel you didn't receive one or you didn't file taxes and didn't get a stimulus, this is your opportunity to reach out to the IRS, or you can just wait and let the money hit your bank account or hit your mailbox. So if you've enjoyed or gotten value out of everything I've said today, please hit the like button, hit the subscribe button. I want your feedback. If I said something that you think there's more information that I didn't cover, or you have more information than I did, I want you to tell me in the comment section below, because I want to continue to provide you value. And as I said in the beginning, all we do is bring you the latest news and updates about anything that's going to affect your Social Security. And I continue to do lives every day. And I hope to see you on the Let's Live tomorrow. So until then, thank you for hanging with me today, this Tuesday evening. Have a good night.